Sorry, you have to put up with one more presentation from me. I hope you're getting used to my accent by now. So this project was actually part of Dr. Merchan's DVSC thesis in Guelph, and he is now one of our surgeons that has stayed on, and I would really like to acknowledge all my co-authors for this presentation as well. So switching topic a little bit, I should probably say what I'm talking about, which is the repeat intralesional treatment with stem cells of naturally occurring SDF tendinitis, superficial digital flexor tendinitis in horses. And that disease, this is actually one of our client horses with the most beautiful SDF tendinitis and significant, as we call it, bow. That's very typical and a common injury in racehorses. And particularly the thoroughbred has between 8 and 43% of SDFT injuries, and the healing of tendon is a particular challenge. If you read the literature, there's up to 80% of horses that re-injure their tendon at one point or another. And despite over 40 years of research, we still haven't been able to find a treatment that provides us with a fully functional tendon after an injury where they don't have a higher risk of re-injuring. And there's a variety of medical therapies aimed to improve the quality of tendon healing, and stem cells have been quite successful in preventing or at least helping to heal these injuries. The same PRP has been quite successful. But what is interesting, there's one older study that actually shows that the controlled exercise protocol is the most important aspect of tendon healing, and that is something that also in this study is so difficult to get your clients, particularly in the racehorse world, to adhere to. So coming back to a slide that you have by now seen the third time is how we think that our stem cells act. And also in this type of injury, I think the mechanism is probably very similar. And there's some work from Roger Smith out of the UK that actually showed a decreased re-injury rate to 18% in SDFT injuries that were treated with bone marrow-derived stem cells. But what is very, very important is that it is injected within 6 weeks of injury. If it was injected later, they did not see that same low return of injury, if you can say it that way. So that is a much improved compared to 56% re-injury rate that was also described by Dr. Dyson in a similar type of horses, because the UK has a little bit lower rates of tendon injuries than we have in North America. So the cryopreserved allogeneic equine cord blood stem cells are readily available, and successful intralesional treatment has been reported with all kinds of injury, SDF, deep digital flexor tendon, suspensory ligament, and it has been shown to be safe, a single injection, but somebody said in the last 2 days already that the idea of repeated treatment is really, we're hoping that we would have a better outcome, because I find initially after a single injection the horses look good the first or second recheck appointment, and then maybe 4 months down the road they tend to pretty much look the same as the others, in my opinion. So we thought perhaps a repeated injection might be more effective in returning these horses to exercise without re-injury. So it needed to be evaluated, and we have shown in joints that it is safe to do so. So that was our hypothesis, that the repeated use of stem cells is for treatment of naturally occurring SDF tendinitis, using intralesional administration is safe and returns the horses to athletic use. And we wanted to evaluate that this is tolerated well by the horse, and we wanted to assess the quality of healing and ability to return to full athletic function in natural occurring superficial digital tendon flexor tendinitis with repeated injections. So the inclusion criteria were that they were client-owned thoroughbred racehorses that had a tendon SDF lesion with a minimum of 25% cross-sectional area, and the lesion had to be sustained 6 weeks prior to the first treatment or shorter, but it couldn't be longer than 6 weeks. It needed to have occurred either during speed training, so bracing or racing, and the age category was 2 to 6 year old. So this is giving you an overview of how we worked with these horses. So this is the first week basically of treatment. It is a little bit misleading as it says discharge here. They were really discharged after 72 hours. But they had a physical exam, subjective and objective lameness exam, an ultrasound, and then they were treated with 20 million stem cells in cryomedia and were evaluated on baseline, had also blood collected at 0, 24, and done 168 hours, which is a week, for CD4 and CD8 lymphocyte assessment. And then group 1 was the stem cell group with 5 horses, and group 2 was the PRP group with planed 5 horses. And the PRP group got ultrasound guided commercial PRP, and in week 1 or week 0, and then the stem cell group, the 20 million cord blood stem cells, and it was repeated 4 weeks later, the treatment again. And then the horses were evaluated every month for 12 months and had a physical exam, a subjective and objective lameness exam, and an ultrasound. Then to come to our results, first thing I have to say, this study was during COVID, and or we started it before COVID, but we had an absolute ban on seeing any research horses. We were only seeing emergencies for a while, so that threw quite a wrench into our study, and you will see, particularly in the PRP group, we ended up having only 3 horses, and we lost 1 horse in the middle of the study because the owner sold it because racing was also not allowed in Ontario. So it was a bit difficult, so the outcome of the study is not as nice as we set it out to be. We lost, particularly in the PRP group, horses. So after the first treatment, the cord blood stem cell group had definitely, after the first and second treatment, an increased inflammation, heat, swelling after injection. On ultrasound evaluation, we had a faster decrease in the circumference of the lesion in the cord blood group after the 2 treatments when you compared it to the last ultrasound recheck at 12 months. And you can see red is the stem cell group and blue is the PRP group. And we actually lost a couple of horses. 1 horse got 1 injection, never came back. And the second horse just disappeared out of the study. So in the end, we had only 3 horses in that group to evaluate. The other thing we found on the ultrasound evaluation is, like you can see here, the needle into the core lesion of the SDF tendon here. And then 2 days later on ultrasound, you can see that needle tract. And I mean, that has been reported before, but what was a little bit frustrating is that needle tract at 6 months, and that is that needle tract at 12 months. So in 4 out of the 5 stem cell treated horses, we actually saw persistent needle tracks. We did not see that in the PRP group, not because we lost some horses, but we just didn't see that in the PRP group. Then the outcome, though, they didn't seem to be too bothered by that needle track that was visible on ultrasound. And 4 of the 5 stem cell horses went actually back to race training and raced 1 or more time. 1 horse I heard a little while ago re-injured, but that was after a year of successful racing. And 1 out of the 5 was retired from racing after the second treatment as a hunter jumper, but has remained athletically sound with the treatment. So that was a nice outcome. In the PRP group, 1 of the 3 patients returned to race training, and 1 horse was retired from racing after the treatment as a hunter jumper, and is also successful, but it doesn't really count as a group for me to compare it to. So it's more a description of what we found in these 5 horses. So the general conclusion we drew from it, that the repeated intralesional treatment using those thawed-pooled allogeneic stem cells resulted in all the horses returning to racing without re-injury when they were following the rehabilitation program. And we had a temporary self-limiting inflammation, but it was definitely there, and lasting needle tracts in the cord blood group. And again, the PRP group is just too small to compare outcomes. So we need larger numbers to really draw a conclusion. And we actually started using an alternative delivery method. We are using intraarterial perfusion with stem cells. We are using 30 million and do the same protocol 4 weeks and later to do that. And this is just a nice image. I always find it so fascinating how beautiful you can see the needle going into the artery. And that's it for this topic. So now you're done with me. I am. And I just want to acknowledge the funding source of Equine Guelph and Arthrex for giving us the PRP, and EQCell for providing the stem cells, and of course all the horses that have participated.
We have time for a couple questions.
I'm glad I overwhelmed you.
Yep.
Thank you. Can you just tell me again, you did the repeated injections. What was the pattern of the repeated injections between the groups?
So 0 and 4 weeks.
And they all received the stem cells for the first injection and not?
So it was repeated. They got both, they got stem cells for the first treatment and the second treatment, 20 million in cryo medium.
And the other group received 2 injections of PRP?
Yes, the other group was 2 injections of PRP.
Okay, and can you remind me what your cryo medium was?
I have to look at Thomas. I'm not allowed to say, so I let him answer that.
I didn't hear him. Okay.
Thank
you. I guess that I just have maybe, I'm not sure if it's a question, I think that's more of a comment. I guess you guys don't think that those MSCs were making into new tenocytes, correct?
I didn't understand you.
You don't think that the MSCs that you were injecting are, differentiating into tenocytes and actually, right? So I guess my point is that I think that we, as a community, I think we should refrain from using the term stem cells because it really hurts us because it just doesn't make, when we call those cells stem cells, it doesn't make sense why are we using them the way that we're using them, right? Because we're not really expecting them to differentiate and form new tissues such as you'd expect from stem cells, but rather for their growth factor and the way that they stimulate healing in the local environment. So I guess that, for me, I'm really sensitive to that because I've seen that kind of coming back at me from reviewers, and rightfully. So I think that, if we as a community not use that term, I think that it will only help us.
I'm really good in writing it down as mesenchymal stromal cells, but
yeah.
if you give 3 presentations on that topic, it's a mouthful.
Yeah, no,
And
so.
You
so
have
I
somebody in the audience that makes sure you're not speaking too long, so stem cells is
Absolutely.
shorter.
So we can agree on maybe MSCs. All right.
Just calling them mesenchymal cells.
Or stromal cells, or whatever, yeah. All right, thank you.